Well, that leads me right into health policy issues. What health policy issues are important for the African American faith community on a national level, state level, or local level, such as the recently passed Racism as a Public Health Crisis resolution that we adopted here in Genesee County?
Hmm. Hmm. Boy, there are so many priorities, and sometimes the expansiveness of the work is a barrier. People just don't know where to start, and I always say it's sort of like a swimming pool. Just get in where you fit in. If you're jumping off the high dive or come down the stairs or cannonball off the side, it really doesn't matter because this is not linear work. It's just building block work, right? One thing builds on onto another. And so certainly issues of access to care are fundamental to health. And we've done really quite well in Michigan because we are a Medicaid expansion state. There's some states that under the Affordable Care Act, Obamacare, as we endearingly refer to it, there are states that could have asked for higher levels and lower minimums of eligibility so that more people could receive health care. Michigan is one that took advantage of that. And so at this point, we have over 800,000 people who were falling through the crack, who weren't eligible exclusively for Medicaid and didn't have private insurance, that now have access to go get help when they're not feeling well, right? They have a relationship, a way to pay for the financial relationship with their physician. So access to healthcare is really important. But another that we've certainly seen in the media is the issue of policing and what is the relationship with our police officials and communities. What does that look like? What's the history of that? And how have we gotten to this point? And certainly we know that nothing is all or nothing, right? There are great, strong cops. There are bad cops, police officers, but there are also great teachers and there are bad teachers. There are great nurses and there are bad nurses. And so we're not trying to condemn or to shame or blame, but to simply share responsibility for how do we look at building authentic relationships with police departments so that the well-being as a health policy for communities could be advanced. Another one that I think about often is not just minimum wage, but a living wage. It would be great if we can increase minimum wage, but are we increasing that to a wage where people can actually feed their children, pay their bills? And we're not talking about exorbitant lifestyles here. We're talking about pretty fundamental, sort of basic existence. But we see people working 2 and 3 jobs, as we say, to make ends meet. And so as a society, I think we have to decide there's so much value in terms of our personal values. Policies come from policymakers, and policymakers are people who have beliefs and values and cultures and histories and experiences. And so policies don't just, fall out of the sky on us, but are we constructing policies like a living wage policy that holds us to be our best selves as communities, as a city, and as a state?